Imagine ordering a parachute off a discount rack just because it was, cheap and promised delivery in 5 minutes.
Yeah, you would literally never do that.
Right. You wouldn't risk your life on a bargain bin safety device. Yet, if you look around at the year 2026, millions of people are doing exactly that with their brain chemistry.
It is wild to see. And honestly, it is a profound level of overwhelm out there right now.
It really is. So if you are out there right now exploring mental health options, feeling completely overwhelmed, or maybe even burned by an AI therapy app or a rushed, 7-minute psychiatry visit, I want to start by reassuring you, you are not alone.
No, absolutely not. We are looking at a healthcare landscape that has shifted at breakneck speed over the last few years.
Yeah, and this deep dive is basically your personalized map out of that incredibly frustrating maze.
Which is so needed. The sheer volume of new options has left a lot of people feeling like they are doing something wrong simply because they can't figure out how to get effective help.
Okay, let's unpack this, because our mission today is to cut through that deafening noise of subscription apps and assembly line clinics and help you understand how to actually choose the right care.
And we have some incredible source material to guide us today.
We do. We are using the 2026 Smart Patient's Guide to Mental Health Care, written by psychiatric nurse practitioner Jessica Walsh, which was published on March 18, 2026.
It is a brilliant guide. Navigating the 2026 mental health market feels a lot like trying to order off a 50-page diner menu while someone shouts a countdown at you.
Yes. That is exactly what it feels like. It is entirely designed for speed, not for what you actually need.
Right. And before you can even begin to find the right provider, you have to understand what is actually on that massive, chaotic menu.
So true. The options have multiplied, but the definitions of what those options actually provide have become, well, incredibly blurred.
They really have.
So let's look at the major categories we are choosing between today. First, there's traditional psychiatry.
Right, the classic model.
Exactly. The pros are obvious. These are the folks with the highest level of training. They diagnose, they prescribe. But the reality of trying to access them in 2026 is pretty bleak.
It is. The bottleneck there is severe. You are often looking at massive wait lists, and once you finally get in the door, the visits are notoriously short and rushed.
Yeah, which is just so frustrating.
Yeah.
Then, on a completely different branch of the tree, you have therapy.
Which is vital. Cognitive behavioral therapy, trauma processing, skill building.
It is critical for emotional support. But, and this is the big catch, therapists cannot prescribe medications.
Right, so if you find yourself needing pharmacological intervention, you are forced to try and bridge the gap between two entirely separate, often uncommunicative systems.
Which is exhausting. And that gap, that friction of trying to coordinate your own care, is exactly where the 2026 tech boom saw a massive opportunity.
Oh, absolutely. They swooped right in.
Suddenly, the market is flooded with AI-supported services. We have got chatbots for mood tracking, algorithm-based symptom checkers.
And of course, the massive explosion of ADHD subscription apps.
Right. They are heavily marketed, they are cheap, and they promise approval and medication in a matter of minutes. But wait, I've pushed back on this a little bit.
Sure, go for it.
If you are struggling to get out of bed right now, or your career is falling apart because you cannot focus, isn't a fast ADHD app or a quick AI chatbot better than sitting on a 6-month wait list for a traditional doctor?
I hear that all the time.
I mean, shouldn't immediate help be the priority?
It is the most natural question in the world when you are suffering. The problem, and what the source material warns about so strongly, is the illusion of treatment.
The illusion of treatment. Wow.
Yeah, convenience does not equal care. If we connect this to the bigger picture, knowing the difference between a health coach, an AI symptom tracker, and a licensed medical provider protects you from wasting your time and your emotional energy.
That makes a lot of sense.
An automated fast-track app isn't just less thorough, it operates on a fundamentally different mechanism. AI is built on language prediction, not clinical judgment.
Right, it's basically just guessing the next word.
Exactly. It can recognize the words, "I can't focus," and trigger a pathway for an ADHD stimulant. But it doesn't have the biological intuition to hear the exhaustion in your voice, look at your sleep data, and realize your lack of focus is actually caused by severe, undiagnosed insomnia.
Oh, man. Using a fast-track app for a complex brain issue sounds a lot like asking a basic spell checker to rewrite a novel.
That is a perfect analogy.
Like, it might catch a few obvious errors, but it completely misses the plot, the tone, and the context.
That captures the danger perfectly. You might think you are getting medical treatment, but you are actually just interacting with a highly sophisticated automated dispensing system.
But recognizing that a quick app isn't medical care is only half the battle, right?
Unfortunately, yes.
Because some of these platforms and even in-person clinics are explicitly designing themselves to look like premium comprehensive care.
They are very good at marketing.
So how do we spot the imposters before we hand over our time and our brain chemistry?
Well, the author provides a very clear framework for this, outlining 9 specific red flags in the 2026 landscape.
Okay, I am taking notes.
The underlying rule is simple. If a provider or a platform checks even one of these boxes, you need to look elsewhere. The most blatant one is the 7-minute medication management appointment.
7 minutes. I mean, you can barely order a coffee in 7 minutes, let alone explain how a psychotropic medication is altering your daily reality.
Exactly. You truly cannot understand a human being in 7 minutes. Psychotropic medications alter fundamental neurotransmitters.
Right.
Evaluating whether a new side effect is from the drug, from a new life stressor, or a new underlying condition takes nuanced, deep conversation.
Not a quick survey.
No. In a 7-minute window, the provider barely has time to log into your chart, ask if you are actively in crisis, and hit refill. It is a structural failure.
Which flows right into another major red flag, the instant ADHD approval services. The source writes that if you are approved no matter what, that's not healthcare. That is a pipeline.
And this raises an important question about the motivation of the entity you are dealing with. Are they evaluating you, or are they processing you?
Processing you. That sounds so industrial.
It really is. A pipeline is designed to move volume. It relies on the assumption that everyone entering the pipe needs the exact same product.
Wow.
True healthcare assumes you are a unique organism and requires an investigation before any intervention.
Here's where it gets really interesting to me. The tech traps.
Oh, yes. The tech traps are everywhere.
Providers who use AI to actually make the medication decisions. Or platforms that hide behind a low $15 monthly subscription fee, but then lock you out of actual care unless you pay for mandatory expensive add-ons.
Is a total bait and switch.
It is.
Yeah.
But the red flag that struck me the most is the human element. The idea of never seeing the same provider twice.
That is a massive one. Continuity is the bedrock of mental health care. Think about the psychological mechanics of healing. Your nervous system is constantly scanning for safety. If you have to re-explain your entire trauma history or your complex list of side effects to a brand new face on a screen every single month, your brain remains in a state of stress.
Because you are basically starting over every time.
Exactly. There is no therapeutic alliance. You are essentially a stranger every time you log on.
And if they don't know you, they certainly don't know your environment.
Right.
The source points out that your job, your stress levels, your living situation, those matter just as much as your biology.
They absolutely do.
If a doctor is just looking at a checklist of symptoms and ignoring the fact that you work night shifts and sleep 3 hours a day, they're missing half the picture.
More than half, honestly.
Looking at all these red flags together, it really is a fast food drive-through for brain chemistry. You get your bag of the window quickly, but the long-term cost to your system is devastating.
The fallout from that fast food approach is profound. And the author states a core belief that I think is vital for anyone listening who has struggled to find the right fit.
What is that?
She writes, if your previous experiences checked any of these boxes, you aren't broken, you were underserved.
You aren't broken, you were underserved. That is incredibly validating.
It really is.
If you've tried therapy or tried 3 different medications and felt like a failure because nothing worked, it reframes the entire narrative. The failure wasn't your brain, the failure was the system.
It completely shifts the burden back to where it belongs. The primary reason this fast food approach fails so spectacularly is its inability to screen for what we call comorbid conditions.
Right, which are super common.
Extremely common. Comorbidities simply mean having more than one condition occurring at the exact same time.
Like anxiety and depression together.
Exactly. The reality of human psychology is that depression, anxiety, ADHD, trauma, and insomnia incredibly often overlap. They're interwoven.
So if a provider only has that 7-minute window, or if an app relies on a 5-question survey, they are only going to catch the loudest symptom.
Precisely. Let's say you present with a severe lack of focus and procrastination. An app takes that data, labels it ADHD, and rushes a stimulant to your door.
Okay, I see where this is going.
But what if the lack of focus is actually a trauma response, coupled with severe anxiety that is keeping you awake all night?
Oh, wow. So you are taking a heavy stimulant, which is going to spike your heart rate and your anxiety even further when what you actually needed was sleep regulation and trauma processing.
And that is exactly how people end up feeling worse. That is how they end up feeling broken. The system treated a symptom in isolation because it didn't have the time or the framework to look at the whole picture.
Which sets up a really critical distinction. If the fast food model is causing this much damage, what does actual deep healing look like, especially regarding medication?
That is the million-dollar question.
Because reading the source material, I was struck by how nuanced the view on medication is in 2026. If meds can be so genuinely life-changing, which the text affirms they can be for anxiety, depression, and ADHD, why are they suddenly framed as the bad guy in these rushed app models?
What's fascinating here is that the medication itself is rarely the villain.
Really?
Yes, the danger lies entirely in the context in which it is prescribed. The text details that the biggest harms we are seeing in 2026 stem from rushed prescribing.
So it's not the drug, it's the speed.
Exactly. When you use a medication to simply mute a symptom without addressing the lifestyle or environmental factors causing it, you aren't practicing medicine. You are just unplugging the fire alarm while the house is still burning.
That is a terrifying visual, but so accurate.
Rushed medications lead to wrong starting doses, zero monitoring, rapid tolerance issues, and the complete masking of underlying trauma.
So the gold standard provider, the one actually practicing modern integrated psychiatry, like the Iron Focus First model mentioned in the source, does the exact opposite.
They absolutely do.
They blend evidence-based medications, lifestyle support, and talk therapy principles all into one cohesive treatment plan.
They treat medication as one tool in a larger toolbox, not the only tool. A gold standard provider will take the time to deeply understand your history.
Because they actually have the time.
Right. They actively hunt for those coexisting issues. They map out your stress factors. They don't rush to hand you a prescription. They explain the pharmacological options clearly alongside lifestyle interventions, and then they rigorously monitor your progress.
When you have a provider who takes the time to understand your unique biological and environmental situation, medications cease to be a risk or a crutch.
Exactly.
They become a highly calibrated instrument for getting your life back. That sounds absolutely incredible. I mean, who wouldn't want that level of comprehensive integrated care?
Everyone wants it once they know it exists.
But we have to address the elephant in the room here.
Yeah.
The economics of care.
Yes. The tricky part.
How do you actually get this? Because high-quality care requires time. And in 2026, time is the most expensive commodity in healthcare.
The guide provides a brutally honest breakdown of the financial reality we are dealing with. It requires looking at the two primary models, insurance and cash pay or membership models.
Let's talk about the insurance reality first.
Yeah.
The obvious pro is that it is cheaper up front. It's what we are all conditioned to use.
Right.
But the cons, they're heavy. The source explicitly states that insurance is great for emergency, acute care, but it is often terrible for mental health quality.
It really is.
It leads to limited medication options, overloaded providers, and those infamous 5 to 10-minute visits.
To understand why this happens, we have to look at the basic math of the insurance model.
Okay, lay it on me.
Let's say an insurance company reimburses a clinic $60 for a patient visit. Meanwhile, the clinic's overhead, the building lease, the staff salaries, the malpractice insurance, the software, all of that costs $500 an hour.
Wow. That math does not work.
No, it doesn't. To keep the lights on and simply break even, that clinic's providers must see 8 to 10 patients every single hour.
So the 7-minute appointment isn't necessarily a symptom of bad, uncaring doctors. It is an economic mandate forced by the reimbursement rates.
The system is structurally incapable of delivering a 45-minute nuanced therapeutic visit under those financial constraints. The volume dictates the care.
So what does this all mean?
It means we have a broken system.
Right. To me, it feels like relying purely on insurance for complex mental health care is like buying that discount parachute we talked about earlier. Sure, you save money on the front end, but when you are midair, when you are dealing with your brain chemistry and your future, the budget option is the last thing you want to rely on.
It is a harsh reality, but it explains why the modern psychiatry landscape is actively shifting toward private, cash pay, or membership models.
The guide lists the pros of this private model, and it's basically the complete inverse of the insurance cons. You get longer visits, you get personalized attention, You see the same provider every time, ensuring that vital continuity. There are transparent fees with no surprise medical bills, and the care is proactive, not just reactive.
The math of a private model allows the provider to step off the assembly line. Because they aren't reliant on volume to survive, they actually have the bandwidth to do the gold standard work.
They can actually be doctors.
Exactly. They have the time to investigate the comorbidities and build the therapeutic alliance. But the guide doesn't just leave you with this economic theory. It arms you with a highly practical tool for navigating this, the first appointment roadmap.
This part is so actionable. It tells you exactly what to expect and how to prepare. A truly great first appointment shouldn't feel like a transaction.
Never.
It has to include a 360-degree review of your history, a discussion of all your symptoms, a deep dive into your sleep, your stress, your trauma. Most importantly, it has to hold space for you to actually talk openly.
The author suggests 5 very specific questions you must ask any potential provider before you commit to their care.
Okay, what are they?
You need to ask, how long are your appointments? Will I see the same person each time? How do you make medication decisions? How do you monitor progress? And what happens to my treatment plan if my life circumstances change?
I love that because it puts you, the patient, firmly in the driver's seat. You are interviewing them just as much as they are evaluating you.
And pay close attention to how the provider reacts when you ask those questions. The text states a profound truth here. If they cannot answer clearly, they cannot help clearly.
Oh, that is such a good point.
Quality always shows itself in the details and in the willingness to take time. If a provider bristles at being asked how they monitor progress, or if they give a vague answer about medication decisions, that tells you everything you need to know about their clinical culture.
Yeah, if they can't clearly articulate their own process, you absolutely should not trust them to tinker with your neurotransmitters. It really is that simple. So as we wrap up this deep dive, let's distill the ultimate takeaway for anyone listening. Choosing a mental health provider in 2026 requires a shift in mindset. It means actively demanding continuity of care.
Yes.
It means demanding a human being who looks at the totality of your life, your sleep, your stress, your work environment, not just a checklist of your immediate symptoms. And above all, it means refusing to be rushed.
Refusing to be processed through a pipeline.
And the source material actually offers a really solid starting point for this. It mentions that practices operating on this integrated model, like IN Focus First, offer something called a first step session.
Which is such a great idea.
It really is. It isn't a high-pressure sales call or a blind commitment. It is simply a dedicated conversation to help you evaluate your situation and find clarity on whether their approach is a fit for your specific needs. Because finding clarity is the first real step to getting your life back.
It represents a much-needed fundamental shift in how we approach entering care. It centers the patient's agency rather than the system's convenience.
But before we go, I want to leave you with a final echoing question to mull over on your own.
I love these.
We've spent a lot of time today talking about AI algorithms and fast-track apps. The guide brilliantly points out that your daily environment matters just as much as your internal brain chemistry, and that AI is certainly not a physician.
Right.
But as AI continues to rapidly shape the environment we all live and work in every single day, making our jobs faster, our communications more constant, and our expectations for instant results more intense. Well, how do we ensure we actively protect the slow, quiet human continuity that is actually required to heal our brains?
That is the defining tension of our era. We are building a world optimized for relentless speed, but our biological nervous systems still require time, safety, and connection to heal.
It's that diner menu again.
Right.
Just because the menu is huge and the drive-thru is fast doesn't mean the food is going to sustain you.
Thank you so much for your curiosity today and for giving us your time. Remember, seeking clarity is the first real step to finding your peace. Keep exploring, ask the hard questions, and whatever you do, don't let anyone rush you.